is One, and for this microbiology medical project, I chose the bacteria Klebsiella pneumoniae. From a clinical research study, Klebsiella pneumoniae is considered open quote the second most common cause of community and hospital-acquired bloodstream infection, end quote. It was named after the German microbiologist Edwin Klebs. The, the The bacteria is in Klebsiella genus and Enterobacteriaceae families. It's a gram-negative bacteria, and on McConkey argaplase, it appears as a mucoid lactose fermenter. It can cause severe infection in the lungs, the bladder, brain, liver, eyes, blood, and wounds. Some strains of Klebsiella pneumoniae can produce the enzyme carbapenemase, which makes it resistant to the antibiotic carbapenem. So carbapenem is used to treat nosocomial infection. So the Klebsiella pneumoniae have bacillus shape, which is a short, blunt, and straight rod. It's arranged in singly, or diplobacilli, which is in pair, or streptobacilli, which is in short chains. The size varies from around 2 to 3 millimeter and is a non-motor bacteria, which doesn't have any flagella, but it does have fimbriae for adhesion. The outer surface coat contains glycocalyx that form polysaccharide capsule. Under India ink is appear a clear hollow in a dark background. This capsule protects them from the defense of the host immune system. Klebsiella pneumoniae can be grown on Nuclean agar medium, which is NAM, or McConkey agar medium, because it doesn't require any complicated nutritional requirement. And it can also be grown on sheep blood agar. You can see that it has circular-shaped colonies with dome-shaped elevation and grayish white pigmentation. Is a non-hemolytic or gamma hemolysis bacteria. It can also be grown on eosin methylene blue agar medium, which is ENB agar. It's a selected medium that inhibits the growth of gram-positive bacteria. And it also have a circular-shaped colonies with convex elevation and pink-purple pigmentation. Last but not least, it can also be grown in nutrient broth, which is in liquid media, and it's appear turbidity throughout the tubes. The bacteria grow best in the presence of oxygen, which make it an aerobic bacteria, but it's also a facultative anaerobic because it can grow in a low oxygen environment. The bacteria can grow in the range of around 50 to 40 Celsius, but the optimum temperature for it to grow is 37 degrees Celsius, which is the human temperature. The bacteria can live in an alkaline environment, but not with the acidic environment, and it is best grown at 7, which is neutral. Klebsiella pneumoniae can be found almost everywhere within the environment. So in the nature, it can be found in soil surface, water, plants, and even in animals. In humans, it can be found in the mouth, nose, and the gastrointestinal tract, which is the GI tract. And because the bacteria has fimbriae, it allows the bacteria to stick or attach to medical devices in healthcare facilities. When Klebsiella pneumoniae reside in the mouth, nose, and human intestine, they are harmless to the host as well as they would not become a pathogen. And people with good health, doesn't likely to have infection from Klebsiella pneumoniae. However, if the bacteria have a chance to move to a different location, for example, your lungs or your brain, it will cause pathogen, or it could become a opportunistic pathogen for immunocompromised or sick patient. Um, the the so Klebsiella pneumonia infection is a communicable disease which can be transmitted from person to person and through contaminated medical objects. There are several risk factors that can lead to higher chance of getting infected by Klebsiella pneumoniae. It's believed that people with high age or means are most likely to get the infection. Moreover, the bacteria is associated with nosocomial or hospital-acquired infection, so staying in the hospital for too long or using a ventilator machine will also affect the chance of having Klebsiella pneumoniae infection. And you can easily get infected when having organ like solid organ transplant or having liver disease as well. So Klebsiella pneumoniae cause many of the disease, and it depends on the from like where the infection come from. So for example, if the infection come from the eyes, it will cause endophthalmitis, or in the lungs, it will cause pneumonia. So first of all, pneumonia. Pneumonia is an infection in your air sac of in the lungs. It will cause fever, chills, pain in the chest, cough, and some severe cases, oxygen deficiency. And if the infection happened in the urinary tract, it will cause UTI, which is urinary tract infection. The patient may experience bloody urine, urinate more often, painful urination, pain in the pelvic or back area. If the infection happened within the kidney, it will cause fever, chills, and nausea. So if the infection is in the area of skin or soft tissue, it will cause cellulitis, myositis, and meningitis, which the patient will experience fever, fatigue, edema, which is swelling, erythema, which is redness on the skin, and then flu-like symptom. The patient may also experience nausea, vomiting, photopia, headache, high fever, dizziness, and confusion. For endophthalmitis, which is infection in the eyes area, the patient will likely have eyes pain, photophobia, a decrease in vision, which is when you have blurry vision, or having white or yellow discharge come from the eyes. And in biogenic liver absence, the patient will experience fever, pain in the right upper abdomen, nausea, and diarrhea. Last but not least is bacteremia, uh, which will cause shaking, chills, and fever. This kind of infection is really serious because it can lead to fatal. So if you experience so if you think that you have bacteremia based on the signs and symptoms, you should go to the doctor as soon as possible to cure the disease. So there are many treatments for Klebsiella pneumoniae, but the treatment has to depend on the organ system that involved, and the lab test must be done in order to find the right biotic to cure Klebsiella pneumoniae infection. So for resistant infection, the patient could use choline or gentamicin antibiotic to cure it. And for patient with UTI, for most cases of the UTI, the patient can use ampicillin for monotherapy. And for complicated UTI, the patient could consider using quinolone, meropenem, vaporbactam, ceftolozane, or tazobactam, or ceftazidime and avibactam. Meropenem Meropenem and Vapobactam is a carbapenem and beta-lactamase inhibitor, work as inhibit the production of enzyme that block carbapenem antibiotic. I'm so sorry, my pronunciation for antibiotic is really bad. So yeah. And for patients that have like an intra-abdominal infection, the patient could consider using ceftazidime and avibactam also. For patients with nosocomial pneumonia, here they can have combination treatment with the help of third generation cephalosporin, quinolone, and aminoglycoside. For patient having endophthalmitis and endocarditis is really rare. It's really rare infection, but like if the patient have endophthalmitis, here they could use intravenous ceftazidime and aminoglycoside to treat it. For patient having endocarditis, a combination treatment of intravenous aminoglycoside and beta-lactam could be used. And for patient having meningitis, here she can use a third generation of cephalosporin and also cefotaxime. So based on a new research from Fudan University in China, they found a new strain of Klebsiella pneumoniae, which is strain XJK1. It's extremely resistant to many types of antibiotic, and they also found 3 new identical plasmids, open court, a large number of resistant genes, and a plasmid LVPK-like virulence plasmid carried by Klebsiella pneumoniae strain XJK1 might be the main reason leading to the XDR, meaning extensively drug resistant and hypervirulent phenotype. This comes from Obesity and Fitness and Wellness Week. Thank you so much for listening to my presentation and have a good day.